it is my pleasure to be able to introduce not one but three speakers for the next talk. Doctors Dr Phelan, Maria Kasenga and Rebecca Jackson. These three individuals are here to talk about GADP remote fellowships as they have been run in our Zambian partnership, the Zambia Anesthesia Development Programme. They have also kindly written in our ZADP impact report, which we've posted in the chat, and we will continue to post in the chat throughout the day, that has got examples of this area of ZADP work and many others that we will be talking about today, as well as other areas that you can look into. So, first of all, Dr Phelan. Hannah is an ST6 anaesthetic trainee working in Edinburgh, Scotland. She was a junior fellow with ZADP for 6 months in 2017 to 18 and is delighted to be back working with the programme in a formal capacity. In addition, she is also an editor for Adventure Medic, an online magazine through which she enjoys editing articles relating to global health. Hannah enjoys problem solving and the variety of working that anaesthesia provides, and like many was drawn to it by the strong sense of being a team. Maria Kasenga is a second year STP MMed postgraduate anaesthesia student currently training at the University Teaching Hospital, Lusaka, Zambia. Previously, she completed her internship in Mansa, Zambia, and did a rural posting from 2017 before joining the Zambia Anesthesia Development Programme in the Zambia Anesthesia Training Programme in 2020. And then Rebecca Jackson. Rebecca is an anaesthetic registrar working in Wales. She was also a junior fellow with ZADP in Zambia and also returned as a remote fellow with ZADP from February to August 21. Currently, she's on maternity leave and enjoying spending time with her 4-month-old baby. We've got a recording of their talk, so I will hand over to these three doctors now. Thank you.
Hi, I'm Rebecca and I was a previous ZADP remote fellow, and what I'm going to do now is just briefly outline how this fellowship developed. So the role developed on the background of a very successful partnership of ZADP that had a legacy of a number of years of working together supporting anaesthetic training in Zambia. However, unfortunately, at the start of the pandemic, the government advice was that all in-country trainees had to return home. So this really left a gap in the support that could be offered. Now, initially it developed in kind of an ad hoc basis, so there were trainees giving remote teaching support, but it really did provide a unique opportunity to really utilise these connections to maintain support for the programme, to see whether we could develop a new remote role for ZADP. So to do this, we took our leads from those responsible for anaesthetic training in Zambia and the trainees themselves. So this evolved really into a peer-led, peer-supported role based on the requirements identified by our Zambian colleagues. So for the first 6 months, we identified 3 needs that we would try and achieve. This included teaching, establishing a journal club, and quality improvement. Now, teaching is a core aspect of the fellowship and was previously. But for the first 6 months, what we did was support junior and senior teaching. Now, the responsibility of the fellow really was kind of administrative to begin with. So it was organising the timetable, setting up the Zoom meetings, facilitating the teachings, and sometimes organising external facilitators for senior teaching. Journal club, so this was identified as an essential component for training. So we needed to start up journal club. And as it happened during our one-to-one meetings with the trainees, one of the trainees volunteered to take this forward. So this meant that it was organised in Zambia. And what the remote fellow did was kind of provide, again, administrative support. So setting up Zoom meetings, occasionally suggesting journals that would be suitable to be presented, and occasionally providing remote support for those trainees presenting a journal on how to critically appraise a paper, and also how to present a journal at Journal Club. Now, the final thing was quality improvement. Now, quality improvement has always been an important role for ZADP, but during our initial discussions, it was suggested that it would be beneficial if we could provide remote QI support to individual trainees. So trainees who had either had an ongoing quality improvement project or were thinking of starting a new one. Now, from this, we had actually 3 really good outcomes. So we started up an MNM meeting that was started from a trainee who was interested in starting this, and that formed part of their QI project. We were able to assist with the data collection for the regional anaesthesia project in 2 different sites. So that was in Dola and Lusaka. And then one unanticipated benefit of the pandemic was that a lot of these conferences were then going online. So this provided an opportunity for the trainees to present their work. So we had a number of trainees who either presented or had their academic work presented at international meetings, which is like a huge achievement, especially considering the circumstances. So that is a very brief outline of how things started. I think now I'm going to hand over to Hannah, and she's going to give you a bit more of an insight of how things have developed over the previous 6 months.
Thanks very much, Rebecca. So since August, 5 further remote fellows, including myself, have been appointed and had the opportunity to carry on the work of the fellowship, building on the fantastic foundation that Rebecca, in partnership with the training leads in Zambia, have created. We've maintained weekly junior and senior teaching, initially once a week for the junior trainees and twice a week for the senior trainees. Despite all the familiar problems of late running lists and challenging clinical cases, as well as preparation for exams and the ups and downs thrown at us by life, attendance has been absolutely phenomenal. Some of the highlights include external speakers talking about their areas of interest, discussions based on current ongoing cases at UTH or NTH, and also the presence of senior trainees and consultants from Zambia. The latter has not only provided setting-specific knowledge and expertise for the trainees with advice on how to circumnavigate limited drugs, consumables, and equipment, but also for the fellows, whether or not we have had the opportunity to work in Zambia. One change that has been made is that the teaching sessions are now a combination of trainee and fellow delivered presentations. This has dropped the frequency that trainees have to prepare presentations from almost every week to every 3 weeks. The aim was to lessen the workload for trainees in response to our growing awareness of their very busy clinical schedules, and in order to give more time to be able to prioritise the increasingly regular M&M meetings and journal clubs. M&M and journal club have also been very well attended, not only by the anaesthetic department, but also by other relevant specialities, and are well recognised by all as a crucial part of clinical governance. They've helped to identify areas for future quality improvement projects and have provided MDT support for live cases at both hospitals. As an example, an M&M meeting led by Dr Chalwe on a patient with a thoracic dissection helped to facilitate a mid-M&M planning discussion between anaesthesia and surgery, leading to the patient having successful surgery and being discharged home. M&M meetings on the death of a patient in trauma theatres by Dr Mack, as well as a paediatric patient by Dr Francis Kapinde, although very difficult topics, have led to open and constructive MDT discussions. At the start of August, each trainee was paired with a remote fellow. One-on-one meetings were offered to provide individual support with preparation of presentations for teaching work, ongoing work with QI projects, and also exams. These meetings have been a great way to get to know each other, to share worries and concerns, and to discuss things like the football results or family, and also to understand the different challenges that we face through our training programmes. They have repeatedly been brought up as a favourite part of the fellowship by all fellows. In January, the first year sat their exams. From the middle of October, additional sessions were added to the programme to introduce Viva practice. In January, both the teaching sessions were taken over by the fellows to allow the trainees to have more time to prepare and to revise, and they used them to summarise key topics to continue their Viva practice and also hold some mock exams. The feedback for these sessions has been unanimously positive. 2 trainees have presented at international events, Dr Christian on regional anaesthesia and Dr Sarah for a GASOC journal club. And we have had two articles accepted for publication, one in the November issue of the International Anaesthetic newsletter by the Royal College of Anaesthetics, and a second with SEA UK. Quite apart from the individual benefits of such achievements to all involved, there are also ways in which we can advocate for GADP, raising the awareness of the work carried out by this partnership and why it is so important. We're now going to listen to Maria, one of the second year trainees, to get a trainee perspective on the impact of the remote fellowship.
Thank you so much, Hannah, for that, and Rebecca, thank you so much for that beautiful review of the beautiful partnership that we have. The Zambia Anesthesia Development Program came into existence about in 2012, and we had our in-country anesthetists from the UK at the time. The whole point of the ZADP was to support the Zambian anesthetists into the delivery of safe anesthesia in Zambia. So this beautiful partnership has allowed for the transfer of core knowledge, as well as skills, as well as development of additional key areas that have already been mentioned, like the journal club, the M&M meetings that have now been taking place during our teachings. Although the suspension of the face-to-face collaboration due to the outbreak of the COVID-19 pandemic was quite devastating, to say the least, it has enabled the development of the now online teaching that we have, the platform that we now have, that we are using now. And it has, it gave way for volunteers, even though they were in remote areas, to take part in the program. And first we had volunteers like Dr. Helen Richardson at the time in my first year, and we also had Dr. Elizabeth Hadman as well. They were one of the volunteers who took up the task when we first started the online platform. The fellows up to now are still quite actively involved in our coordinating and even facilitating of our teachings that will be going on with the trainee anesthetists, including the journal clubs that they have already talked about so well, the morbidity and mortality meetings that we now get to discuss, even patient to patient, even I might be on call, I can actually get to discuss a case with a fellow who's available at the time. And then quality improvement projects as well. We get to have meetings with our mentors that we now have, and quite the future is bright for this mentorship program we now have in partnership at the moment. So this is quite made possible by the Zoom sessions that we get to have. And of course, everything being helped and even facilitated by our coordinators here in Zambia, the likes of Dr. Hazel Mpasha and Dr. Bangu in Ndola as well. They have been the ones to assist us with that. So I'll say the utilization of the online platforms has quite allowed for more regular sessions than we might even have had it previously. And with continuity of learning, while still maintaining our clinical duties, which are so busy here in Zambia. As we may be aware, we have such few physician anesthetists, but we get to be online, getting to learn and still be able to do our clinical duties as well. So for the formal fellowship that is now going on at the moment, which we get, initially we had just one, Rebecca, when we started 6 months ago. Now we have 4, we get to have mentors now. So the delivery of the mentors program has quite increased the consistency of things that are going on, including the journal club and M&Ms, and even undertakings of more quality improvement projects for the trainees. And although we would like to see the eventual return of the in-country fellows, we have found that there are clear benefits to the online teaching that we have. The remote fellowship can continue to run, even if that happens. When we get to have the in-country, we can still continue the remote fellowship. And then as well as we get to have international speakers, specialists speakers who get to give us their inputs, research that they have done, so that we get to use it here in Zambia. That was not previously possible without the online teaching, without the remote fellowship program. And then people have published papers. People are attending virtual conferences now. And initially you had to travel, you had to go through the process of having to be there at the conference, but now there are virtual conferences that we as trainees are very excited and have been participating even this year that it took place. So there are definitely, I would say, the remote benefits, even like in terms of access to examiners that we get to have. We get to have international examiners who get to examine us even for our exams that get to take place in Zambia as well. So this has only been made possible with the online platform, with the remote fellows getting involved, and it's been definitely a collaboration that we want to continue for the future to come. Thank you so much.
Thank you very much, everyone. I think that we've got Rebecca and Hannah here today. Maria is currently in the operating theatre and may be able to join us a little bit later. Thank you for joining us together today. Fantastic presentation, and it's really lovely to hear how passionate everybody is about this training programme and what a great training experience people are still managing to have despite the challenges of the pandemic. In particular, we know that we really have lost a lot of teaching in terms of there being less face-to-face training or options for training in a clinical environment with the demands of the pandemic. But to hear Maria and other people in the impact report say that actually there is still teaching happening every day, despite all of those stresses, is just incredible. So well done. I thought I'd ask you the first question. I want to understand a little bit more about how you set up this mentorship concept and what the outcomes have been of that.
Yeah, so I think it really began with Rebecca taking the time to contact individual trainees, which she can say more about. So we really followed on from that, and also essentially stole the idea of the buddy system, partly to have an opportunity, because we don't have that face-to-face aspect of the fellowship, to get to know people a bit better, and in both directions. I think it's quite difficult when you're on a screen where you often don't have videos running because of internet connection, to get a better understanding of how well the teaching programme is going and how well supported the trainees in Zambia feel by the remote fellowship. So having some one-to-one contact, which hasn't been limited to the named trainee to fellow group, there has been a lot of cross-group conversation, which has been fantastic. I think has, from my point of view, has made it a lot easier to understand which things that we've implemented have been useful and how to adapt the fellowship so that we're really trying to address the greatest needs of the training group.
Fantastic, thank you. And both of you were junior fellows in country and then have returned as remote fellows during the pandemic. How do you think the experience of international partnerships has developed and helped you and trained you as doctors in the UK?
Well, I'll answer that one then. So I think it's quite easy to see when you look at our training curriculum, if you look at the Annex G and all the non-clinical aspects, like a fellowship like this ticked all the boxes. So when I was trying to apply to go less than full-time, it's actually very easy to justify it, because you have all those core concepts of teaching, supporting trainees, especially through quality improvement, leadership management opportunities, and they're all there. But I think specifically what's helped me is having that peer-to-peer support and that peer-to-peer learning. So I think with ZADAP, the uniqueness of it is that trainees are working with other trainees. And I think that's something that has really helped me, because you not only get a trainee's perspective whilst of a trainee working in a difficult situation, you also can offer your trainee perspective. And I think that's a really important voice that when you're thinking about any kind of international partnership, you have to also consider what it's like for trainees. So that's what I would think. That's what I would say.
Absolutely, thank you. And we've got a question from Leslie here. She says, great talk. I think that the remote fellowships have been one of the success stories of the pandemic and have actually increased access to teaching for trainees and teachers alike. And I'll second what Leslie said. I completely agree as well. Would you agree? And are there any things that you think are just better in person despite those successes?
I think that I think it has been successful. I think from the feedback that we've received, it has been successful. And I think it would have been difficult to assume the success it would have had prior to the pandemic, because especially Rebecca and myself, we've been out in country and thoroughly enjoyed our placements. So moving to a remote setting did seem like losing quite a lot of what you get face to face, but I think it has been a success. And I think part of that, and maybe something that will retain a remote fellowship in the future, is that you can provide access to teaching no matter where those trainees are or those fellows are, and you can provide partnership between people who wouldn't necessarily have been able to take an active role in this partnership. So one thing that's been mentioned to me repeatedly, including by Maria, who hopefully will be able to join us, is the ability to listen to experts in certain fields through this remote link, people who wouldn't necessarily have been able to speak face to face. So I think there are lots of benefits to the remote nature of this fellowship. And things person to person, I think probably the well-being aspect is easier person to person. Although the mentorship side of it has been good, it would be nice to have a cup of tea or coffee together and gain a little bit more of that body language and sort of fully understand everything that both yourself and that trainee are going through. And I think that's something that is very difficult to replicate across the screen.
Hopefully we can be back to that very soon, because I think it's something that we all miss very much. Are there any top tips that the two of you have found or worked out in terms of facilitating remote teaching and dealing with challenges like internet, not being face-to-face, that you think we as teachers could all benefit from? Sorry.
Yeah, I think we've probably got things. I think for me, I don't know about you, Rebecca, but it's been a lot to do with making sure that you're aware of all of the barriers to attending teaching, whether that's by the fellow or the trainee. So things like having the on-call rota for the following month, so that you can better understand when people will be on call, and therefore it's probably not the best time for them to be presenting a topic. From my point of view, the Zambian trainees have a remarkable ability to spin many, many plates. And I think it's something that, unless you're aware of the on-call commitments, it's very easy to be completely unaware of all the things that people are juggling. And so just having a better awareness of on-call commitments, for example, can be useful, so that you can better plan a teaching schedule that more people can attend and have benefit from. Just be one thing.
Thank you. I think we may have Maria in the call now as well. Maria, are you able to unmute yourself?
Hello, yes. Good afternoon. How are you?
Very well, thank you. Thank you so much for joining us and for your fantastic presentation. We can just hear and feel the enthusiasm you have for anaesthesia in your training programme from your voice. That was really lovely to have today.
Oh, thank you so much.
Maria, how have you, as a trainee in Zambia, adapted to online teaching and all of the other challenges of the pandemic that have affected your training?
Yeah, that's a very interesting question. But I think we've managed, with the help of the remote fellowship. I mean, it really was our rescue. At first, we didn't even know what was going to happen. But when we started under those volunteers in the beginning, and then later on, it became like a recognition to say this is a fellowship that is taking place. And then like it kept getting better and better. It kept getting better and better. And at the point, and now like today I was even thinking, I'm like, oh my God, I can't believe we can actually do more. than we are doing now. And it's just because it's been just getting better and better. People have just been coming up with more and more ideas to brighten the remote fellowship. It's been wonderful.
That's fantastic. Thank you. I think we talk a lot about healthcare innovation and how much we learn from each other, but we have to remember the innovation in education and teaching as well. And I've seen people teach in ways that I would never have thought of. And in your particular training program, I know that exams have been held using a hybrid of face-to-face and remote support a number of times now during the pandemic, including the first online OSCE I had ever seen in my life, which was incredible.
Mm-hmm.
So that really is fantastic. Well, there's a question here from Dave Snell. How could we better remote teaching going forward? And how should we involve more UK and international trainees in delivering the training? And I'll ask all three of you that. What do you think? Do you want to start, Rebecca?
Yes, okay. Yeah, I think we should involve more UK and international trainees in teaching. I think probably what we should do, I think maybe advertising possibly, or having a membership scheme of people who are interested, and then you've got a group of people you can call upon if they want to teach, and it can be mutually beneficial. So if you've got people who are doing advanced modules that would be of interest to other people teaching, then that helps fulfill their criteria, and also they've got some expertise that they can share. So that would be one way I would suggest.
Thanks, Rebecca.
There has been a lot of appetite for that. Thanks to you, Sonia, for providing a list of interested parties. So we do have a sort of a cohort of trainees and consultants who have offered their help over the next few months, and will be gradually put into that training program. And I think it's also, well, I'd be interested to hear what Maria has to say, but it's probably better to have more than one voice delivering the training, just to provide a bit more interest.
Yeah, no, I'm already just so excited just because of how far we've come. Hannah, just like look at how far we've come. So it's really it excites me for that, and of course we can always use more. The more we have, the better, because as I was talking to my boss, Dr. Hazel Mpasha, last time. She was like, we have so much hand now with the technology that's going on. We have more examiners on the panel than we would have had when we were in person before the pandemic. So yeah, the more the better. The initiative of even having specialists, experts in fields of certain studies. I mean, it's been interesting. Like, we'll be all glued to just listening to someone talk about this field that they know so well. And before, we don't have that. So yeah, the more the better, please. Thank you so much.
I think we've been all glued to our seats with these journal clubs and M&Ms as well, and research meetings, and we've all learned so much. It's brilliant. And I'll also perhaps just mention our huge congratulations to everybody in the Zambian programme and the Ethiopian programme who have undertaken exams during the pandemic, which hasn't been easy, and have done so well. I know in Zambia, 5 trainees completed their specialist training fully, and another 2 have since finished their final exams. During a pandemic, that's incredible. And when we've got so few or such a low density of physician anaesthetists, those numbers really make a big difference to patients. So well done, and our congratulations from all of us. If there are any more questions for Rebecca, Hannah and Maria, we'll make sure that we address them during the conference or deal with them afterwards. But thank you so much, the 3 of you, for your presentation.